Hey everybody, this is Andrew Lee here, and I just wanted to make a quick video about how to do a Medicare presentation because I do get a lot of questions about this. So I'm just going to keep this as easy as possible because that's how I talk to my clients. The simpler, the better. We do not have to overcomplicate this, okay? So step one, let's say you have somebody that's interested in being your client, be it over the phone, be it you met them somewhere and they're interested and they want you as their agent. So the first thing that you would want to do is have them sign something called a scope of appointment form. That scope of appointment form is basically an allowance to let you quote some of these plans, and just it's basically a document saying, hey, here we are today talking about this plan, and basically it's to cover our butts as agents and let the clients know that this is a legitimate Medicare presentation. So once you get that done, of course you're going to find out if they have some kind of Medicare A and B, and that's going to be the basis for any Medicare policy, be it a Medicare Advantage plan, be it a Medicare supplement plan. You would need that A and B in place in order for you to enroll them into one of these plans. That is a must. Part B has a premium associated with generally, so let the clients know. They probably already know that because it probably comes out of their bank account, or comes out of Social Security, right? And this is a must. Everybody that pretty much has, for the most part, everybody that has Medicare will pay a Part B premium. So let them know that, but that'll set them up for one of these plans. And the reason why is, let's say you have a client on the phone and you have a client, face to face with you, you're sitting across the table from one and each other, and you're trying to do a presentation. After you get that scope out the way, you just have to let them know, hey, so the Medicare that you have right now, if it's just original Medicare, if it's just, their red, white, and blue card, and that's it, you got to let them know that they only cover 80%. They only cover 80% of doctors and hospitals. That's not including drugs. So there's a huge gap there. Right? There's a gap. So you do have to let them know, we have to get you one of these plans in order for you to fill that gap. So that if you're ever in a situation where, God forbid, you go to the hospital and it's $100,000, guess what? You're on the hook for $20,000 of it. If it's $1 million, $100,000 bills can rack up easily. If you're inpatient, that's not hard to do. If you have $1 million, you gotta let them know that the next one's gonna be $200,000. Right? And this doesn't stop, by the way. This is not a one-time payment, like, oh, I paid $20,000 for that and I'm done for the year. There's no out-of-pocket maximum. So you have to let them know that this is going to be an occurrence every single time. So you have to get one of these plans to have some kind of stop loss, right? So I always equate it to, and I do this for a lot of clients, I let them know, hey, go ahead and draw a T-chart for me. If I'm sort of a visual learner, but it also, it's an activity to do. You can make it fun, however you want to do this. Have them do a T-chart, and on the left-hand side, you're going to write Medicare Advantage, also known as Part C, I'll throw that in there, and Medicare Supplements. Just like this, have them draw a T-chart. So we're going to start with Medicare Advantage first. So I let them know, hey, Medicare is like a coin, right? There's two sides to it. So just depending on what your situation is, we're going to find out which you're going to be a candidate for. And it's your job as the agent to do that. That's why we get paid for what we do, is to find that out and then customize your plan according to what they need. So let me start with Medicare Advantage. So Medicare Advantage generally has a network. The doctors, let's say your client has a doctor that they have to go to. Like, this is a non-negotiable. I have to go to that doctor. Your job is to find a plan that has that doctor in that medical group, so it is in network. So generally with Medicare Advantage plans, they're generally like an HMO, PPO type of style. Here in Southern California where I'm at, generally like mostly HMOs, but there is a network. HMO or PPO, there is a network. This is also a all-in-one type of plan, so you let the clients know, hey, this will cover your major medical stuff, right? Your day-to-day, your doctor visits, your specialist visits, your x-rays, your hospitalization, everything in between. and also covers, OTC benefits, dental, vision, hearing, and most importantly, prescription drug plans. So it's an all-in-one type plan. So, if it makes sense for them to do it, if their doctors are in network, then of course get them a Medicare Advantage plan, right? The doctors, again, have to be a network, meaning, let's say you had a client that had one doctor in one medical group, because all doctors will be in, some doctors will be in one medical group and another will be in another. If you have a client that has one doctor in one medical group and a specialist in a totally different medical group, we're in a tight spot as agents. That's where we have to find which plan is going to have both of them in the same medical group. So the doctors do have to be in network, and mind you, that this is part of our job. If we do not do this part correctly, we are going to get some allegations, right? It is the name of the game. So if you want to do your job properly, make sure you nail this part. Make sure both doctors are in network. If there's 3, you're doing your best to make sure you're going to wherever you need to go. You can use enrollment platforms such as, Sunfire, or, even directly to the carrier website themselves to see that the specific plan that you're trying to quote them, the doctors are in network. They have to be in network. This is very important, guys, okay? Extremely important. And again, the Part D prescriptions are built in. So again, that's, I guess, a convenience factor for some. But the Part D is plugged into your Part C, which is the Medicare Advantage. So just know that. And this is technically privatized insurance, right? So original Medicare, again, like the A and B, just original Medicare itself is through obviously provided by the government. If you go and get them on a Medicare Advantage plan, basically relinquishing the rights of, the government's relinquishing the rights to take care of you, and then now the private insurance company is going to take care of you. Meaning, if a client goes on a Medicare Advantage plan, they're not technically on original Medicare anymore. They're on a Medicare Advantage plan. They're on Part C now, okay? And generally $0 for the premium. So that, of course, gets, some people going, but just make sure you explain the pros and the cons. It is $0, and it does look, you see all the commercials out there with, saying $0 this, $0 that. It looks sexy on paper, but this may not sometimes be the best fit for somebody. Sometimes it could be. If you had a client that you ask them, hey, realistically, how often are you going to the doctor? Do you even have a doctor? And if the answer is like, no, pretty healthy, I manage my, weight, or I exercise a lot, or I do holistic stuff, whatever it is, then this might be a good fit, right, financially, obviously. And then, of course, there's a stop loss. So in the case that there is an emergency or anything like that, this will still cover it, and then some. Medicare supplements. So this is also part of original Medicare, like I mentioned. The only difference between this in terms of, the 20% that it plugs up is that, the original Medicare has 80% coverage, and then this will actually plug up the 20%. This is, again, taking place of original Medicare. With this plan, you're free to roam. So let's say, for example, you have a client, right? And that client has 7 doctors, and all of them are life and death. If they don't go to this doctor, if they don't go to all 7 of these doctors, and if they miss any appointments, if it's life or death, then you are going to gravitate towards this plan, because now they don't have to align the networks with the doctor. So if they have a specialist here, specialist in that medical group, specialist in that medical group, primary care physician in that medical group, and it's just spread out all over the place, and you just can't find a policy, that a Medicare Advantage plan that's going to have all of them in the same network. And if they don't even want the HMO type of style, because they just can't do a referral every time, and they're just not in a situation to be in that type of space, then you're going to get them a Medicare supplement plan, right? Because again, they're free to roam. 97% of doctors that take Medicare are going to take a Medicare supplement plan. So original Medicare supplement, free to roam. Now, you do have to enroll policies individually. So like I mentioned, there's a premium for Part B. You have to explain that to them. You have to explain that there's a Part B premium. There's an additional premium for the Medicare supplement plan. So there's Part B, there's a Medicare supplement premium, and then you have to get them a separate drug plan, okay? So it's not all inclusive like this one. You do have to get them a separate drug plan, and also you do have to enroll them if they wanted a dental policy, for example, or like a hearing policy or a vision policy, for example. You do have to enroll individually into that as well too. So a client might end up having 3 different carriers, but it's a package kind of deal, and you as the agent just explain it to them that it's like that, and they'll understand. So you do have to enroll individually the respective products that they want. Now again, this is original Medicare, okay? So we're not relinquishing original Medicare to a privatized company, even though some of the companies could be the same companies as a Medicare Advantage plan in terms of name. It's a different product, right? So it's basically just plugging in that 20%, everything except for medication, okay? Everything except for medication. Just remember that, everything except for medication. The medication, even in this situation, doesn't go towards the out-of-pocket maximum. Medication is, another reason why some agents would get, allegations is because, the 2 things we need to do in our jobs is find the right network, right doctors in the right network, and find the drug plan that's going to have the lowest cost for the prescriptions. That there's no curveballs with there's things like of course the donut hole. I don't want to get too much into that with clients, but if a client has 7 medications, it's our due diligence to find the dosage, the usage, and look up every single drug, let them know how much it's going to be, because prescriptions are very much a hot topic, and they could get extremely expensive. And of course with seniors, they don't play with their money, right? Sometimes it's tight. So just make sure that your presentation is tight, so you're never in that situation. So you're doing your due diligence as an agent to find them a drug plan that's going to take care of their policy or their needs at a pretty affordable rate, or at the most affordable as it can get. Sometimes you can get more than they wanted, but you just have to explain it to them that, hey, this is just the cost of the drug. Hey, is there a generic version? If there is, I can look for that as well too, but if there isn't, it is just sort of what it is. Of course, there's other alternatives to look around, but of course, do that at your own discretion. It comes with time and experience to suggest that path. So again, this does have a premium associated with it. So again, your job is to find out first if they're a Medicare Advantage client or if they're a Med Sup client, right? If they have a lot of doctors, most likely Med Sup, right? And if they were paying $1,000 something when they were 64 for their health insurance, which, if you guys know, people in their 60s, they probably have the highest premiums of health insurance, in 60 to 64, and then they're like, I had a PPO system before and I really loved it, and they can afford to get a Medicare supplement plan, then of course get them that, because this very much gives you that peace of mind knowing that you can go anywhere that doctors take original Medicare. Like I said, a lot of them do. If they're in a situation where maybe they have a Medi-Cal, Medicaid situation, and those there are plans geared towards them, or if they're just, hey, I'm happy with getting that Medicare Advantage plan that I saw on TV, or I heard about this plan that has good dental coverage, and I heard about this plan where I get $50 a month towards my groceries, my utilities. There are going to be situations like that for Medicare Advantage. So I just wanted to bring up both, and hopefully that helped. Hopefully that helped, because it's basically a case-to-case basis when it comes to presenting Medicare. But I just wanted to do my best to give you some of the scenarios that happens with presenting a Medicare plan. So hopefully that helped, and I'll see you guys at the next one.